chapter, we will discuss the principles of tooth preparation to understand the underlying principles on why we do this thing and how we do it. Tooth preparation can receive direct or indirect restorations. In this chapter, we will focus about the indirect restorations, where it is usually indicated when we have missing cusps or gross caries, or we have an endodontically treated teeth, cracked teeth. One of the most seen caries are in the proximal areas of the teeth that are adjacent to an existing crown. The reason for this is two reasons. The first one is because the proximal contact points are not being adjusted well, and the other reason is that when we were doing the preparation, we did damage to the adjacent tooth when we wanted to prepare the proximal walls. So we leave what is called a lip or a fin of enamel without resulting in excessive tooth reduction. So in this situation, the enamel was maintained mesial to the path of the diamond as the reduction progressed. As for the pulpal degeneration that occurs many years after tooth preparation has been documented, especially in the maxillary anterior teeth. There is a higher risk of necrosis than for any other tooth type. Here we see the degradation of the pulp throughout the years of a prepared tooth. These are the burrs under the electronic microscope. These are the diamond burrs, and this is the tungsten carbide before preparation. And here after preparation, where we see that the diamond has got damaged, and the carbide also got damaged too. So the continuous changing of the burrs is important to prevent the overheat and decrease the friction between the teeth and the burr. Here we see the clodging on the tip of a diamond after a preparation of only one molar preparation, which this result decreases the efficiency of the cutting of the burr. Here there was a conservative using what is called a partial coverage restorations to restore the laterals by doing a bridge that between the canine and the incisor, and only the labial surface was prepared. When we do an incisor reduction during the preparation, we must maintain the occlusal anatomic shape of the teeth, because a flat occlusal preparation will result in either insufficient clearance or an excessive amount of reduction. So we reduce the buccal cusp for 1.5 millimeter and the lingual cusp for 1 millimeter. Here when we discuss the shape of the finishing line, we have several types, and we will discuss them in details and their indications and how they are made. This is a comparison between the shoulder margin and the chamfer margin. The shoulder margin gives us more space for the bulk material of the restoration, which gives us more aesthetic results, but it is not as conservative as the chamfer margin. Here we emphasize the importance of the preparation smooth margins that will make all the subsequent steps of tissue displacement, impression making, and the laboratory procedures all easier and will increase the long-term life of the restoration. And the feather edge margin, it is the simplest margin preparation where the tooth is considered smooth and with the restoration, and there is no horizontal shelf. There is a challenge that these types of margins does not provide adequate material bulk, and it creates an contoured emergence profile when the laboratory tries to build the restoration, so they over contour the restoration to get the correct anatomic. For the other restorations, a minimal thickness of 1 millimeter is essential. In the new current mechanically improved ceramics like the zirconia and the lithium disilicate, a 0.5 thickness with resin cements is sufficient. There is a study that is actually interesting, a 4 years randomized clinical trial on crowns that had a feather edge and a chamfer fine lines. A comparison between them came to conclusion there was no significant difference in clinical survival and success rates between the two margins. However, zirconia crowns with feather margins had a higher probability of bleeding on probing than the chamfer design. So the relationship between the restoration and the periodontal tissue is what is compromised when we do the feather edge margin. A 10-year retrospective study have seen that the lithium disilicate with feather margins that the failure rate was 1.8% only. When there is a poor preparation design and it led to an increased margin length, a periodontal disease may occur. Also, a rough irregular margin makes the fabrication of an accurately fitted restoration almost impossible. It is only possible when we have a smooth finish line. Now let's talk about the margin design types. We have the feather edge that we mentioned before, although it is conservative, but it is only used when we have a bonded ceramics restorations because it does not provide a sufficient bulk material for the building. The beveled one, here we can discuss them in picture. This is number A is the feather, C is the chamfer, and D is the beveled, E is the shoulder, F is the sloped shoulder, and G is the beveled shoulder. Under the microscope, to get a deep understanding, is that here the H is the feather. We see there is no a horizontal shelf here. This is the chamfer where we have a round angle, but the shoulder we have a more of an 90 degrees or right angle between the teeth and the margin. This is the sloped shoulder, and this is the beveled shoulder. This is here in this region. It is so the beveled shoulder is so aesthetic, but we must take a consideration about the biological depth that we should not invade it when we use this type of preparation. For the chamfer margins, they are recommended for cast metal crowns. Here they are emphasizing the holding the burr tightly to the tooth surface and preventing the tilt it away from the tooth, that it may produces what is called an undercut, where we prepare the cervical area more than the incisal area, which causes an reverse taper of the preparation and makes the fitting of the restoration more difficult. Also, tilting the burr toward the tooth leads to an excessive convergence and reduction loss of the retention. Usually, the margin thickness is half the tip of the diamond. Otherwise, an unsupported lip of enamel may result. This is the shape of the undercut, where the opposing axial preparation wall diverge in an occlusal direction. This is the comparison between the chamfer and the shoulder. The shoulder margin provides more bulk of metal than a heavy chamfer margin, which may facilitate the laboratory steps. This is the shoulder. But the disadvantage of a beveled shoulder is that it must be placed deeper in the gingival sulcus. This is under the microscope. This is the shoulder, and this is the beveled shoulder. In the situations where we have a non-replacement of a missing tooth, and it led to a supraocclusion of the teeth, and this led that we made a teeth reduction and preparation for both teeth in both arches to help get a restoration that is balanced occlusally. When we have a compromised teeth with residual tooth that is insufficient, and we are unable to do periodontal crown lengthening, we do what is called an supplement preparation with secondary retentive features that are called the grooves or the boxes, or using a pin retention. These are used only for cast alloy restorations and not for ceramics. There is a difference in the retention between the inlays, onlays, and the complete crowns. The inlays can act as a wedge during cementation or function. So, if the cusps are weakened, fracture will occur. A cuspal coverage onlay provides better protection, but it lacks the retention. However, the complete crown provides the best protection against the fracture. Also, it has the best retention, but it is associated with periodontal disease and poor aesthetics. We will discuss the concept of retention form, the resistance form, and preventing the deformation of the restoration. Although they are theoretical concepts, they are clinically not possible to have one without the another, which means that there are a couple of considerations during the preparation that must be considered, including the name retentive or resistance. The quality of preparation to prevent the dislodged in the parallel path is called the retention form, and the resistance prevents the lateral forces. We maintain the retention by getting two opposing walls that are parallel and they are opposite to each other, which will create the primary retention of crown. Another consideration for the retention is the lotting agents. The zinc phosphate is not adhesive, but it is what is called, it increases the frictional resistance between the tooth and the restoration, which means that it prevents one surface from sliding with each other. So it increases the friction between the sliding metal parts to facilitate the excessive escape of the lotting agent. A taper of the preparation must be made to an extent between 6 to 10 degrees during the preparation, and it is achieved when we prepare parallel and the burr itself has a taper, so it will make the sufficient taper that we want of the walls. This is the when we do an excessive tapering, we risk getting what is called an undercut. An undercut is where we make the cervical diameter of the tooth narrower than the occluso-axial junction. So we get what is called a reverse taper. And it is impossible to set a complete crown of similar geometry. Increasing the taper more than the normal will decreases the retention form. Also, the concept of the surface area, where we have a tall crown where the axial walls have sufficient length. This will make the retentive quality of the tooth better. When we have a short and wide crown, we get the less retentive crown. The complete crown has a double retention than the partial coverage restoration. The retention is affected by two things: the taper and the grooves and the boxes that we discussed earlier. But the most important is the taper, that has more influence on the retention, because the grooves does not increase the surface area significantly. But what it does is that it limits the path of the placement to make it only a one path placement, which makes the movement less familiar and therefore increases the retention. The adhesive resin cements are the most retentive in comparison with other lotting agents. Although glass ionomer is considered adhesive, but it forms weak bonding, that it is more of a lotting agent more than a bonding agent. The long-term studies shown that there is a deterioration of the resin-dentine bond in association with a nanoleakage, where small ions or molecules permit the hybrid layer. A 3 mm preparation height provides an adequate resistance, but additional height is necessary as the tooth diameter increases. So a range between 3.5 to 4 mm is sufficient. The modification that we discussed about the grooves and the boxes, they are not so common in the clinical practice, although the failure data suggests that they should be familiar. And they are usually located in the buccal and the lingual side rather than the mesiodistal side. To get a good color match of the restoration, a minimal reduction of 1.5 millimeter is required. To create the sense of the color depth and the translucency. As for the incisor reduction, it is a 2 millimeter is recommended to enable the ceramist to achieve a good aesthetics, with caution to not do an excessive reduction of the incisal surface to prevent the reduction of the resistance and the retentive form of the preparation. We must have a sufficient thickness for the ceramic to cover the opaque layer, and which makes the reflection of the light more direct and makes the restorative material very noticeable, especially in the gingival and the incisal threads, where we use an opaque modifying stains in these areas. So understanding the underlying theories of each step is crucial. To get a successful preparation, when we follow the steps and we do not do a jumping ahead of steps, this will increase the efficiency of the chair time and will make the quality of the preparation more durable. We first do the incisal reduction, then we prepare the marginal proximal surface, then we do the labial and the lingual surfaces. Lastly, we do the finish line smoothly and see if there is a need to do the retentive grooves and boxes with finishing touches of beveling and polishing, smoothing the tooth and the margins before we take the impression. That's it. Salam.